might do different than what we have done?
I would think that we would collectively have done things a lot different.
COVID-19 entered the state in mid-March and has made its mark ever since. It's anyone's guess as to how things might be different had we seen this thing actually coming. Arkansas's doctor, when he speaks, all ears on him, alongside Governor Hutchinson every day, Secretary of Health, Dr. Nate Smith. He's been leading the fight against the coronavirus, breaking down the data and case numbers daily for Arkansans. Our Jay Bir sat down with Dr. Smith to talk about the lessons learned and where we're headed.
What do we actually know about this virus?
Well, we're learning new things all the time, but there are still some very critical questions that are not fully understood. We do know that wherever it's the details of its origin, it is very well adapted to human transmission. Really, I can't think of another virus that spreads as readily and as rapidly as COVID-19. It's spread throughout the world in a matter of months.
Dr. Fauci has kind of said some things like maybe we've kind of gone too open too fast. Is that safe to say, or has Arkansas maybe approached this the right way?
Well, I mean, there's two ways to take that question. One is, how have we as a nation dealt with this, or how have we as a state? We as a state, I think, have done about as well as we could with the resources that we have available to us, you know, with some of the constraints that we've had in terms of supply chain. We've tried to take advantage from as many lessons learned from elsewhere, but this is a situation where everyone is experiencing at the same time, and no one's ever done it before. Typically, you'd have at least someone who had done it before. You could learn from them. We're all having to some extent, make educated guesses and to do it together. And I think we've done it here in Arkansas about as well as we could. I would like if more Arkansans perceived not only that this is a serious problem, but this is a serious problem that they can really do something about, and that the efforts that they make will protect not only themselves, but their loved ones and their communities. And I think sometimes that message has been distorted from various sources.
Was there anything that you might do different?
I would think that we would collectively have done things a lot different. You know, if we knew where things were going to end up. Certainly having earlier, larger testing capacity would have been a benefit. You know, we're still learning, and there are things that you know, that I might have done differently last week or the week before if I knew exactly where things were heading.
When will this be over?
That's not the $1 million or $1 billion, trillion dollar question is, when will this be over? I was kind of hoping it'd be over by you know, by the middle of this month, but it doesn't look like it's going to work out that way. Dr. Romero will have plenty of work to do.
To hear more of the conversation between Jay and Dr. Nate Smith, and to learn more about the ins and outs of the battle of COVID-19 in Arkansas, be sure to watch Capitol View on KRK Sunday morning at 8:30.